As a mom of a young boy that loves to swim until his fingers turn to prunes, I'm very interested in this next segment because he's also suffered from this ailment at least twice this summer. Yeah, we're tackling swimmer's ear and other ear pain issues with Dr. Tobin. He is with Ohio ENT and Allergy Physicians, the sponsor of this segment. Good to see you, Dr. Tobin.
Nice to see you, Robin.
All right, summer is winding down, but we are still going to the pool. We are still taking swimming lessons, and this is something that has affected my family, so I know it's affected others. Let's talk about swimmer's ear and what that is.
Right, so swimmer's ear is just that in most people. It's a condition that occurs after prolonged water exposure, and the ear canal is where the problem occurs, and the skin gets a little bit irritated, and then the bacteria on the surface of the ear find a way in and create an infection, and it's a painful infection. Kids will complain that their ear aches, it hurts to touch the outside of the ear. Usually it's a trip to urgent care, and it's a pretty easy diagnosis most of the time. And these are exquisitely painful infections and usually respond very quickly to antibiotic ear drops, and I've got an example there. Prevention methods, avoiding Q-tips because the wax that our ears produce is protective. When an ENT looks in an ear and they see a clean ear, to us, that's not a healthy ear. We want to see a little bit of that wax in there. And some warning signs, so let's just say your child has an external ear infection or a swimmer's ear. If they're not responding rapidly to the treatment, should get better very quickly. Sometimes a trip to the ENT to clean the ear out and get the infection out of there to allow the drops to work a little bit better. Other warning signs, if you're immunocompromised, have diabetes, or are on medications that reduces your immunity, then these infections can progress very quickly because the infection quickly leaves the skin and gets into the bone and the cartilage which is surrounding it. And that's why they're so painful, and that's why they can progress pretty quickly.
And that's the thing, as far as prevention too, I know there are, over-the-counter drops. Can you do things before it gets to that infection state?
Absolutely, yeah. And so swimmer's ear drops are alcohol-based drops. And those work really well to dry the water and disinfect the ear. As long as you don't have a hole in your eardrum or ear tubes, which can't be used with those, will dry and disinfect the ears. So good habit to get into. Yeah.
Well, good to know, and good to know as well what to do when your kid goes back to school and comes home with an aching ear, which is going to happen to a lot of folks, right? I mean, back to school session, that is kind of, or season, that is kind of when every kid gets in there and gets their fresh set of germs.
Right.
Right?
Right.
So
we're
what's
getting
happening?
into so we're getting out of swim season after we get past Labor Day. Kids are going to get back in school. It's going to get a little bit colder, and then the upper respiratory tract infections start. And so some of these will be school-age kids, and some will be babies. Babies eustachian tubes. So on this model, the eustachian tube is what ventilates the middle ear space. Their eustachian tubes are still developing. They get more colds. Their immunity hasn't fully developed, and so they're predisposed to middle ear infections. And so rather than in the ear canal, this is behind the eardrum. Fluid collects because the eustachian tube isn't ventilating properly, and then bacteria from the throat find their way up the eustachian tube and create a middle ear infection. Eardrops won't work for that. That takes oral antibiotics to treat that.
And there are obviously many reasons, like you said, that they can get that, and there's also ear pain that's unexplained. And so all of these where people get it, you call it referred ear pain, right? All of these things, you probably need to go to an ENT though and see where the source is of this ear pain.
That's right, yeah. And this is the patient who comes in and says, my ear's been hurting for a while. I've been to urgent care a couple times. They said, well, maybe there's some fluid. Maybe it's a little red, but they haven't seen anything that's really impressive. And right now, the #1 cause of referred ear pain that we see is temporomandibular joint pain. Clenching the jaw, grinding the teeth at night. Sometimes the dentist will mention that. But this pain hurts right by the ear. The jaw joint is right under and in front of the ear, and for all the world it feels like an ear infection. Your hearing can be muffled. You can get ringing. It hurts. Sometimes you'll have a little bit of clicking in your jaw. And then there are even some potentially more serious referred sources of ear pain because of what we call the shared innervation of the ear. So there are nerve endings that go to the ear, that go to the tonsil, to the voice box, to the throat, to the sinus, to the neck. And so unexplained ear pain can be a problem, and even a potentially serious problem in any of those locations.
I'll tell you, in my experience from having a child who's had a couple sets of tubes, a husband who's had ear pain, they say it is the most painful thing to happen. So go get professional opinion on whatever your ear pain may be caused by, because getting it fixed sooner rather than later, always optimal. So Dr. Tobin with Ohio ENT and Allergy, thank you for being here.
Oh, thanks so much.